thought you worked for an orthopedic home health.
I worked every those as a
Yep. I said it'll come
Is it Southleaf? I used to work at Neuro. Okay, so you saw.
I'm on your clock.
Oh my God. 35, 40
you
years ago.
probably know him.
I think they're still there.
You know Ron. Well, he retired. He was there for you.
Yeah.
Mike's are live already. Just turn the camera.
Yes.
He was great.
Yeah, he was. Well, I hardly remember.
Oh, yeah. That I know when I started like probably doing a lot of work for 15 years, but I've never. He's still with like they've all retired.
Yeah,
You
yeah.
probably know all that.
Robin.
Yeah, well, I wasn't there real long.
Robin.
And then I went to the.
No one has heard, so I didn't want to start if he was.
I'll send a quick message.
No, it's okay. He didn't respond, but I didn't know if you knew something.
No. Barely been able.
It's not you. It's not like last minute. So I'm just
If he
maybe had a conflict.
my guess is if he didn't respond.
He's got a conflict. Yeah, I just wanted to be.
Yeah. No, thanks for asking.
Yeah.
Personally, I don't.
All right. We are at 6. If we can all please stand. I
pledge allegiance to
the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right. Well, thank you everyone for being here. Another special meeting that we've had to call. For starters, our next regular board meeting will be on October 3rd at 5:30 right here again. And then our main reason of being here is that we were informed that we have a vacancy on the board, and so to comply with the current state codes, we have been asked to create a list of 5 individuals to submit to the commissioners. This is a different process than what normally happens. Usually, an appointment gets made open to the public, and people will submit their resume over to the commissioners, and then the commissioners do what they do to choose whoever they choose. But this is, I think, kind of an exciting change or difference. We as the Board of Health get to do our due diligence and provide our opinion and work and recommendations as to who 5 individuals that we believe would be good nominees for them to consider. If you look upon this, the recommendations or the requirements, 3 of the individuals have to fall from that list of 11. 1 has to be a licensed physician. We do have a Republican vacancy, so we had asked that these nominees are registered Republicans. I think these are the easy requirements to fill. Going forward and looking for a new appointment, many of us have spent countless hours one-on-one talking with each other, talking with others. Many people from the community have contacted us with a desire to serve and be considered for this appointment. In these 6 short days, a lot of work has gone into considerations as to who we should nominate. We focused on individuals who have a history of being from Porter County or living in Porter County or serving Porter County, whether it be in their profession or in their private lives. Also, with the new funding that we've received, we took into consideration people's experiences and the way that they can contribute to the health department, adding new perspectives or experiences that we feel would be beneficial and necessary, and also a commitment to collaborate and bring out the best in others. We believe that these candidates will give our commissioners a wide array of experience, skill, and knowledge base. They share positivity, integrity, leadership, and a desire to give back to our community. This is considered, I think, a leadership position, and I think one of the best qualities of a leader is to bring out the best in those around them. We have a mixture of familiar names and faces and new names and faces, again, to provide our commissioners with a wide array of people to choose from and an exciting group, I think, to consider. So that being said, from all of our discussions, I currently have a list. I think as the leadership position, it's all kind of fallen upon me to collect all of this information, but I want to reiterate that this has been very collaborative with the people who have communicated with me or Dave or Dr. Stamp. And I have this list of 5, but obviously we can add more to consider as well if we need to. So the first one on my list is Martin Moeller. Obviously a name that is familiar to us, right? I tried to ask him how many years he's been serving, and he was like extremely humble as he usually is. Was it? He told me he thought 16 years total.
20.
Right? Okay. He's just such a humble man. And I know he's served at this position of chairperson for, I think, something like 12 years. You know, in asking why do you want to be considered for this position, he responded with he wishes to be a layperson representative on this board, to lobby for the non-health members of our populace that may have reservations about the efficacy of the health department and the programs, and would want to have more of a public opinion, a non-medical opinion. This gentleman has a history of being a business owner, massive leader on this health department. He has seen this health department through decades of change and development. So I think in this exciting time where we're going to have change and development, he would be a tremendous asset. I don't know if anyone has anything they'd like to add.
I would like to add that one of the benefits of having Martin on the board is that he has experience in the vital records area of public health, which a lot of times we don't get on our board, and a lot of times we don't get from the public or whatever, because, and that is because he runs a funeral home. So that is an area that is potentially helpful. He also is a conduit, a liaison, so to speak, with our coroner.
Yeah.
Also, many times they are funeral directors also.
And, you know, I think in this time where we're really focusing on getting more vital statistics and data, this is a great attribute for him to have. He actually said his previous service on the board has allowed his experience in septic systems, which I don't think any of us can say we have. I was like, wow. Restaurant permits, vital statistics, nursing programs. So he is a wealth of knowledge in terms of the health department. Our second nominee is Dr. Derek Gasper. Another familiar name, another person who has served this Board of Health and was willing to continue to serve this Board of Health. Dr. Gasper is a physician who practices family medicine locally. He has had, you know, leadership positions in that role. He has worked with nursing homes. You know, Dr. Gasper is just a wealth of knowledge. He has a lot to say, and he does it in a diplomatic manner. I think he's a fantastic human being and a great attribute to this board.
Tireless physician.
Tireless physician. That's a good way to describe him. Our third nominee in this group is Tom Gooding. He is a layperson, was a captain with Southwest Airlines, also retired Navy vet with 20 years of service in the Navy. He is a layperson, but married to a retired nurse, school nurse, has raised a nurse. Again, a gentleman who lives in this community, who is involved in this community and church, along with his family. And he's a recruit of Dr. Stamp's, right? Yeah.
Yes, yeah. So as someone who has a number of family members in the medical field, but not being in medicine himself, he brings kind of a unique perspective of seeing both sides of things, and he has some experience in negotiations and those kind of areas also in his professional career.
Yeah, he noted that he's had like local union representation, has worked with leadership at the airlines, you know, in handling, I think he wrote over 8,000 pilots. So that's pretty impressive. Along with being, you know, obviously being a veteran, just that alone, I think, is such a, you know, a respectable quality. Also, Dr. Stamp has quite the record of making fantastic hires and judgment of people. So I think if you get her seal of approval, that means a lot to me. Then we have Dr. Kimberly Brunt. She is a clinical psychologist and also an associate professor of psychology. I particularly reached out to her myself with this new funding. I think, you know, a lot of what's been brought up over and over again is to address mental illness and psychiatric issues. And so this woman, so I asked her to send me her resume. I made her bring it down from 30 pages to 8. She's been a licensed clinical psychologist providing mental health services in Porter County for over 20 years, both in community mental health and private practice. She says, in my experience, I believe that improving and maintaining physical and mental health are essential to sustaining a person's ability to be successful in life. She is from Chesterton. She has raised her family in Chesterton, 3 who have already graduated from high school or in college or postgraduate school. Her husband works at the mill. She's extremely involved in our community. She also teaches at the Purdue Northwest campus. She has worked at Porter Stark. Her resume is extensive. One of the things I also found her to be exciting with, she is a researcher. She has published research. She teaches people how to research. And she has listed the things that she's been published for along with the students that she's mentored in their research. And so just lots of clinical, you know, and experience in the psychiatric community, which I think would be super beneficial for us moving forward. Our last name is Dr. Diana Brogan, Dr. Dee Dee Brogan. I think all of us know who Dr. Brogan is. She's an amazing human being, a pediatrician with Associated Peds. She states that she's a resident and employed business owner in Porter County since 1998. She would like to contribute to her county by serving in the medical scientific knowledge, evidence-based fact, positivity, and energy. And those last two, positivity and energy, I think really encapsulate the type of person that Dr. Brogan is. I don't think I've ever not seen her be positive, helpful, supportive, and excited in everything that she does. She has also an extensive history of volunteer work. She's on staff in Chicago. She volunteers, she mentors. I believe she mentored your daughter in her pediatrics rotation, she mentioned to me. Just an amazing human being. You know, when I was speaking to her, and I will say we've taken the time to speak to all of these individuals and, you know, made sure that they're aware of the responsibilities and what we ask of them. You know, she was on her way to Bible study when I was speaking to her about this. 5 amazing human beings that I would be proud to hand over to the commissioners. And I think a good array of knowledge base, of expertise, of commitment to our county and our board. And I'm open to any other additions or comments.
I certainly think it would be of benefit to have either a clinical psychologist or a pediatrician on our board.
I think that's what like kind of had me reach out then with what we're doing. Yeah, I mean, just in talking to Dee Dee, you know, I was talking about the things that were, you know, where she knows, I mean, where our stats lie in this county and the things that we need to work on. And, you know, in 2 seconds, have you used this service for postpartum? Like probably 4 times a day I call them, you know, because, you know, I mean, she's a wealth of knowledge, a wealth of experience. And specifically in the area of, you know, child, infant, obviously dealing with moms and maternal stuff, and just, you know, I think would be a great attribute with us going forward with our funding and the planning that we need to do. And I'm going to tell you what, she's excited. Like, this is something she's really excited to do. She has spoken to her partners. to carve out her time and her schedule. Dr. Brunt has done the same. She's spoken to the people at Purdue. So I think that's exciting.
Dr. Brogan takes care of a lot of patients in Portage area also.
Yes.
Which would give us
Yes,
a
a
bit
breadth
more
of
North
knowledge.
County,
For sure.
yes.
Yeah. Kim is in Chesterton. Dr. Brogan is in Portage as well as Valpo. So, yeah, I'm hoping that they are agreeable to the.
Candidate.
Yeah, exactly.
So
So,
these are the 5 that we.
yeah.
Journey.
No.
Just making,
Nobody reached out to me per se about.
well, just by the email that was sent. I mean, that's why I reached out. But,
Sure, yeah.
I think these are some incredibly knowledgeable folks with great integrity and a willingness to serve. These names will go to the commissioners and then they will decide with these names, correct?
Well, so I believe they may choose from this list of 5.
Okay.
You know, if we pass this along, it is to their discretion as to how they move forward.
Okay.
We are obligated to turn our, recommendations, and then I think the wording is that they may choose
Okay.
from this list.
Well, I think it's a good group for them to.
I would hope so. I think we've done a lot of the legwork for them, and really, have the opportunity to, kind of attest to working with these people or their knowledge base,
Yeah.
their skill.
They all could bring something unique to the table.
I think that was our goal, and many of us speaking, like to kind of have what, if you want psych, here's psych. If you want peds, if you want a layperson, this type of stuff. If you want someone that has served and done a good job, if you want somebody new. So, as I was collecting so much, honestly, and going over it with many of you, just trying, there was even more people that are willing to serve. So we are in a fantastic place, that we have so many good people that would like to, contribute in a positive manner.
So do we need a motion?
Motion.
That we
I think I personally think, you would know better than me, if we are all good with this grouping of 5, that we make a motion to approve this grouping of 5.
Makes sense.
Yes?
And
Motion to
motion,
move these 5 up to the commissioners for decision.
I'll second.
So we'll do a roll?
Yes. Dr. Bonson?
Yes?
Dr. Fleming?
yes.
Terry?
Yes.
Kathy?
Yeah.
Robin?
Yes.
Michael?
Thank you. So we have,
Public gets to put any input to get our,
Dawn, we are not in your living room.
it was a question.
You can come at the end of class and we can discuss.
At the end of class, okay.
At the end of class, yes. Yeah. So the next thing that we had to just quickly kind of add on, to be honest, because there were, 6 counties that you mentioned that didn't opt in to the state funding, that money that they could have received now gets redistributed to the counties that are receiving funding. So we are receiving an extra amount that we will now have to kind of put into our budget that will need our board approval one more time before Carrie can present it to the county council.
Thank you. So it's just over $60,000. So they just took and then they allocated it per county population. And we were able to increase that 10%. So as you know, we can take a maximum of 10% from this fund and set it aside for capital improvements. And so the proposal is that we would do that. And then from there, there were a couple of areas. So for example, postage. Years ago, our postage, somebody put like $10,000 into the postage machine and it had never had to be refilled. And so this year we did have to, we just recently had to redo the postage. And so we found out that even though in this fund, this postage had solely been for if we had to do emergency. So let's say we lost this building and we had to operate vital records off-site and we were gonna buy postage. But we found that we wanted to increase postage a little bit because of the increase in the cost of postage. So we put a little bit more into postage in here. Posing, we put a little bit more.
Okay, here you
So I apologize, you guys. And then there were just a few other areas that were already existing where things were added in. So for example, in maintenance agreements, for a software program that was environmental, they were getting a new software program. And that is we already had money set aside for that, but it has a lot of capabilities. And so our hope is that we can look into expanding those as well. And then down at the bottom under capital outlays, as we have started moving forward with meeting with the architect for the expansion, and we're looking at, they're going to first be moving coroners and they're going to move the veterans to give us that space. And so we are probably going to need some additional funding. And so that's where some of those furnitures and fixtures, we added money in that line item for those things. And then for the office equipment as well down there, in the 44100 line, that is for the printers that the nurses have in the back hallway. They have been seeing a lot of stress lately as we have been having some servicing issues with the machine that we lease with the Savin. And so we just kind of wanted to make sure that we've got something. We need to replace those. We need to be able to do that. Does anybody have any questions?
All sounds reasonable to me. So I will make a motion to approve these budget changes.
A motion.
Second. Roll call, please.
Okay, Dr. Bossom,
Yes.
Dr. Fleming,
Yes.
Terry,
Yes.
Kathy,
Yes.
Robin,
Yes.
okay.
Very good. So that concludes what we were on our agenda today. Our next meeting, where we will see you all again,
Third.
the 3rd at 5:30. Meeting is adjourned.
So, does that count